Infectious diseases know no borders. They travel across continents, affecting people regardless of nationality or socio-economic status. HIV, AIDS, tuberculosis, and malaria have ravaged communities worldwide. These diseases have left a trail of devastation, particularly in regions with limited access to healthcare. These diseases disproportionately impact the most vulnerable among us. They exacerbate existing inequalities, making it even harder for affected communities to break the cycle of poverty and illness. Addressing these global health challenges requires a unified, collaborative effort. It demands the cooperation of nations, organizations, and individuals working together towards a common goal. The Global Fund to Fight AIDS, Tuberculosis, and Malaria embodies this spirit of partnership. It is a beacon of hope for millions around the world. Established in 2002, the Global Fund operates on a unique funding model. This model is designed to maximize impact and ensure that every dollar is used efficiently. It brings together governments, civil society, the private sector, and affected communities. This inclusive approach ensures that diverse perspectives are considered in decision-making processes. This tripartite approach ensures that resources are used effectively. By pooling expertise and resources, the Global Fund can tackle these diseases more efficiently than any single entity could alone. It also promotes accountability and transparency. Regular audits and community feedback mechanisms help maintain trust and ensure that funds are used as intended. The Global Fund provides grants to countries to support their national responses to these three diseases. These grants are tailored to meet the specific needs of each country, ensuring that interventions are relevant and effective. These grants fund a wide range of interventions. These include prevention programs, testing and treatment services, and educational campaigns to raise awareness about these diseases and support systems for people affected by these illnesses. Community health workers play a crucial role in providing care and support to those in need. The Global Fund's impact has been undeniable. Through its efforts, countless lives have been improved and many communities have been given a chance to thrive, and millions of lives have been saved. The success stories are numerous, each one a testament to the power of collaboration and dedication. However, significant challenges remain, particularly in the fight against tuberculosis. Continued efforts and sustained funding are essential to overcome these hurdles and achieve lasting change. Looking ahead, the Global Fund remains committed to its mission. With ongoing support and innovation, we can envision a future where these diseases are no longer a threat to global health. Tuberculosis remains a leading infectious disease killer worldwide. Despite significant advancements in medical science, it continues to pose a grave threat to global health. It claims over 1 million lives each year, leaving families devastated and communities in mourning. The impact is felt deeply across all continents. The emergence of drug-resistant tuberculosis has further complicated the fight. This new challenge requires more sophisticated and targeted medical interventions. It demands innovative approaches and sustained commitment from the global health community. Collaboration and continuous research are key to developing effective solutions. The Global Fund recognizes the multifaceted nature of the tuberculosis epidemic. It understands that a comprehensive strategy is essential to make a significant impact. It understands that biomedical interventions alone are not enough. Community engagement and education play a crucial role in the fight against tuberculosis. Social, economic, and gender-related factors significantly influence vulnerability to tuberculosis. Addressing these factors is vital for effective prevention and treatment. These factors also impact access to prevention, diagnosis, and treatment services. Ensuring equitable access to healthcare is a fundamental step in combating the disease. To effectively combat tuberculosis, we need to understand and address these underlying determinants. This requires a holistic approach that goes beyond medical solutions. This includes acknowledging and tackling the gender inequalities that fuel the epidemic. Empowering women and promoting gender equality can significantly reduce the burden of tuberculosis. The Global Fund's approach is grounded in the principle of country ownership. Countries are best positioned to identify their unique challenges and priorities. They are in the best position to develop tailored solutions. The Global Fund supports countries in developing funding requests. These requests outline the country's strategies for combating HIV, AIDS, tuberculosis, and malaria.
The process of developing these requests is collaborative. It involves diverse stakeholders, including government agencies, civil society organizations, and communities affected by these diseases.
Gender plays a crucial role in shaping vulnerability to tuberculosis. Biological and social factors intersect to increase women's risk of contracting and dying from tuberculosis. In many settings, women face barriers to accessing healthcare.
These barriers can include social norms, economic constraints, and limited decision-making power. Recognizing this, the Global Fund mandates that countries integrate gender considerations into their funding requests. This means conducting gender analyses. These analyses identify the gender-related barriers hindering tuberculosis response. They also highlight opportunities to promote gender equality and ensure equitable access to services.
Section 5. From analysis to action-building gender-responsive programs. Gender analysis is a crucial step in the development of programs that are responsive to the unique needs of both women and men. By understanding the different challenges and barriers faced by each gender, we can create more effective and inclusive health interventions. This may involve designing targeted interventions specifically for women and girls, ensuring they have access to the necessary resources and support. These interventions can range from educational workshops to specialized healthcare services tailored to their needs. It may also include addressing deeply rooted gender norms and power dynamics that perpetuate inequalities within communities. By challenging these norms, we can create a more equitable environment where everyone has the opportunity to thrive. For example, a gender-responsive TB program might include strategies to improve women's access to healthcare. This could mean creating safe and welcoming spaces for women to seek medical attention without fear of stigma or discrimination. This could involve providing transportation assistance to ensure that women can reach healthcare facilities easily and safely, removing one of the significant barriers to accessing care. It could also involve offering childcare services at healthcare facilities, allowing mothers to attend appointments without worrying about the care of their children. This support can make a significant difference in their ability to seek and receive medical care. Additionally, engaging men and boys as allies in promoting women's health is essential. By involving them in health initiatives and educating them about gender equality, we can foster a supportive community that champions the health and well-being of all its members. Section 6. Country Coordinating Mechanisms. The cornerstone of implementation. Country Coordinating Mechanisms, or CCMs, play a pivotal role in overseeing the implementation of Global Fund grants. CCMs are national bodies with representation from government, civil society, and other key stakeholders.
The Global Fund requires that CCMs have balanced gender representation. This ensures that the perspectives and priorities of both women and men are considered in all aspects of program implementation.
Section 7. The power of partnership securing gender-responsive grants. When a country submits a funding request, the Global Fund reviews it rigorously. This review process assesses the quality of the proposed programs. It also evaluates their potential impact. The Global Fund actively encourages countries to develop gender-responsive proposals. These proposals clearly articulate how they will address gender inequalities. They must also outline how they will monitor progress towards gender equality objectives. Section 8. Monitoring and Evaluation: A Gender Lens on Progress. Monitoring and evaluation are essential components of any successful program. The Global Fund requires countries to establish systems for tracking program performance. These systems must include indicators that measure progress on gender equality. Regular monitoring allows programs to identify what is working well and where adjustments are needed. It also helps to ensure that programs are accountable for achieving their gender equality goals. Section 9. The importance of data disaggregation is key. Data collection and analysis are crucial for understanding the impact of programs and informing decision-making. The Global Fund emphasizes the importance of collecting disaggregated data. This means collecting data by sex, age, and other relevant demographic characteristics. Disaggregated data allows us to see how different groups are being impacted by programs. It helps us identify disparities and tailor interventions to meet the specific needs of marginalized populations. Section 10. Learning and adapting, a continuous cycle of improvement. The fight against TB is an ongoing process. It requires constant learning and adaptation. The Global Fund encourages countries to share their experiences, both successes and challenges. This exchange of knowledge and best practices is essential for accelerating progress towards a world free from TB. It allows us to learn from each other and to continuously improve our approaches. Section 11. Towards a future free from TB. Leaving no one behind. The Global Fund's commitment to gender equality is not simply a matter of social justice, it is a strategic imperative. We cannot hope to end the TB epidemic unless we address the gender inequalities that fuel it.
By working together, governments, civil society, the private sector, and affected communities, we can create a world where everyone has an equal opportunity to live a healthy and productive life, free from the threat of TB.